I want to show you a number of different shoulder mobilization techniques for people that have really stiff shoulders, frozen shoulder, maybe even shoulder arthritis. You just have to be careful, and other types of tendonitis in the shoulder. So sometimes you hear the term Spencer technique. I'll show you some of those techniques as well. So this is my trusty sidekick, my model Jordan. She has great shoulders, but we're going to pretend they're stiff. So I like actually with a patient lying down, supine. So let's say flexion, I often anchor here at the top of the shoulder. I grab about the elbow, careful not to compress the ulnar nerve, and I'm going to come up, and let's say she's restricted here. I can make that an articulatory technique where I'm just coming in and gently working on that, gently trying to work that and gradually increase that range of motion. Or I can make that muscle energy where I say, hey, can you maybe just gently push down into my hand? Good. And what she's doing, she's actually pushing down to the side. And I say, push in my hand for just a few seconds. I say, 1, 2, 3, now relax. She totally relaxes. She's relaxing. I'm going to gauge the barrier and see, now push down again. 1, 2, 3, and relax. Great. I can do that 3 or 4 times and gradually keep increasing that range of motion. You can use that same theory also for abduction, moving the shoulder away. So let's say if she's coming abducted, I can say, can you maybe pull down towards your side again? 1, 2, 3, and relax. And I can repeat that muscle energy little by little, or I can make that an articulatory technique where I'm just gently kind of coming up here, coming up. Now, in this position, on their back, I really like being able to do traction. And I'm actually going to hold the arm like this. I feel bad, her arm's like in my armpit. I'm holding her massive biceps, and I'm going to stabilize here, but I'm actually going to lean back and do a bunch of traction. I'm really pulling on her shoulder, and I can really pull. I have a lot of control. Now, you have to be careful, obviously, if they have serious shoulder injuries, but if they're just stiff, I can really do good articulatory techniques, combining forward flexion with some abduction, almost a circumduction like this. You just have to be careful not to do too much force, let pain be their guide. Last thing I'll show you, maybe on their back, so there's internal and external rotation. This is external rotation, internal rotation, but the tendency when I go down, that shoulder, the ball and socket joint, has a tendency to pop up. So I often will compress and stabilize, and then I go down. I use that same approach of articulatory techniques, or if I want to do muscle energy, I say gently push into my hand. She's pushing backwards, that's great. And relax, and I can repeat that 2 or 3 times. I can do the same thing, same principle, going into external rotation. If she wants, she can push into me here. Last thing, let's maybe have you turn on your side. If you want to do some on the side, you use those same principles. Do you mind if I take your elbow? You can do circumduction like this. Again, coming forward like that, back and forth. I can do my forward flexion like this. Notice I'm stabilizing that shoulder and I'm kind of coming back up here. Or I can do internal rotation. There's a couple ways to do that. One of my favorite ways is to have that hand behind the back. But if they're really tight, this can be hard. And then I can just gently push in here, or I can stabilize and gently push like that. Again, I make that articulatory technique, or I can turn that into a muscle energy technique. Anyway, learning a number of the different shoulder mobilization techniques can be really helpful for people that have stiff shoulders for various reasons. A lot of times in the office, I will do a special injection called hydrodilatation for frozen shoulder, and then I manipulate them and do a bunch of these mobilization techniques afterwards. So good luck. Try some of these mobilization techniques.